In this video, we're going to break down exactly what the Cyclospora parasite is, why it poses a uniquely dangerous threat to older adults, what warning signs to watch for, including some that are easy to miss, and most importantly, what you can do right now to protect yourself or a loved one. Before we talk about why older adults are at risk, you need to understand what you're dealing with. And this is not your typical stomach bug. Cyclospora cyatanensis is a microscopic parasitic organism, not a bacterium, not a virus, a parasite, a tiny single-celled organism that invades your body and lives off of it. And that distinction matters enormously for how it's tested and treated. Now, let's talk about what makes this outbreak specifically dangerous for older adults. And I want to go deeper than the standard headlines because there are at least 4 distinct biological reasons why this infection hits harder in older age. Reason number 1, an aging immune system. As we age, our immune system gradually becomes less capable of mounting a rapid, effective response to new threats. Scientists call this process immunosenescence. The most important change is a decline in both the number and effectiveness of certain white blood cells called T cells, the soldiers of your immune system that are responsible for hunting down and killing infected cells. Parasitic infections are particularly problematic because they depend on these T cells to be cleared from the body. In a younger immune system, that response is fast and robust. In an older adult, it can be slow and incomplete. Research has shown that older adults mount weaker immune defenses against parasites, which can allow the infection to take hold and persist longer. This is consistent with the observation that Cyclospora symptoms tend to be more severe in older patients, and that the diarrhea is more likely to come back weeks later. This is one of the most underappreciated dangers in geriatric medicine. Older adults have less total body water compared to younger patients. Their sense of thirst is weaker, meaning they feel less thirsty even when they're already dehydrated. And their kidneys are less efficient at holding on to fluids. The result? An older adult losing fluids through severe watery diarrhea can become dangerously dehydrated in a much shorter window of time than a young person. And dehydration in older adults doesn't just mean feeling lightheaded. It means falls, confusion, sudden kidney damage, and hospitalization. During a cyclospora infection, your small intestine is impaired in its ability to absorb nutrients. For an older adult who may already be at risk for malnutrition, low protein levels, or age-related muscle loss, a condition doctors call sarcopenia, even a week or 2 of poor absorption can worsen that trajectory. In classic textbook cases, cyclospora causes explosive watery diarrhea, but the symptoms can vary widely. They can include loss of appetite that comes and goes, stomach cramping, fatigue, gas, low-grade fever, nausea, and weight loss. And these can last from a few days to months or longer. Older adults may show up primarily with deep fatigue, loss of appetite, and weight loss, with milder or less frequent diarrhea. If you or a loved one are over 60 and experiencing any combination of these symptoms, unexplained fatigue, decreased appetite, bloating, or on and off loose stools, Cyclospora should be considered, especially given the current outbreak and the fact that this infection peaks in spring and summer. The first-line treatment for Cyclospora is a medication called trimethoprim sulfamethoxazole. Most patients know it as Bactrim or Septra. It is the most effective medication against this parasite. The standard dose is 1 double-strength tablet taken twice daily for 7 days. Now, an important clarification, ciprofloxacin, commonly known as Cipro, one of the most commonly prescribed antibiotics, is significantly less effective. In a head-to-head clinical study, Bactrim cleared the infection in 100% of patients, while Cipro cleared it in only 70%. Cipro is considered a backup option only for patients who are allergic to or cannot tolerate sulfa drugs. So if your doctor prescribes Cipro for a suspected parasitic diarrhea during this outbreak, it is important to discuss whether Bactrim would be more appropriate. Many of the most common medications taken by people over 65 interact directly with either the cyclospora infection itself through dehydration or with the Bactrim treatment required to cure it. Let me walk you through the most important ones. Interaction number one, diuretics, aka water pills. Furosemide, hydrochlorothiazide, chlorthalidone. These are among the most prescribed medications in older adults, primarily for high blood pressure and heart failure. They work by making you urinate more, which lowers fluid volume and blood pressure. Now add severe watery diarrhea to the mix. You have a patient losing fluids from two directions at the same time. This can rapidly cause dangerous drops in sodium and potassium, two minerals your body needs to function. Dangerously low sodium can cause confusion, seizures, and even coma. Dangerously low potassium can cause muscle weakness and dangerous heart rhythm problems. If you or a loved one is on a water pill and develops signs of this infection, you need to contact your physician immediately. The water pill may need to be temporarily stopped. Additionally, there's a specific drug interaction to be aware of. The FDA labeling for Bactrim warns that in elderly patients who are also taking certain water pills, primarily the thiazide type, like hydrochlorothiazide, there is an increased risk of a dangerous drop in blood platelet counts, which can cause abnormal bleeding and bruising. So the combination of a thiazide water pill and Bactrim treatment deserves extra monitoring. Interaction number two, metformin. Metformin is the first-line medication for type 2 diabetes, taken by millions of older adults. It is generally very safe. However, metformin should be temporarily stopped during severe illness, vomiting, or dehydration. When the body is significantly dehydrated, kidney function can decline, and because metformin is removed from the body almost entirely through the kidneys, it can build up to unsafe levels. This buildup can contribute to a rare but serious condition called lactic acidosis, a dangerous buildup of acid in the blood. The American Diabetes Association is clear: metformin should be held during severe illness, vomiting, or dehydration. The metformin FDA label also specifically lists dehydration from diarrhea as a risk factor. Talk to your doctor or pharmacist before stopping any medication. Interaction number three, ACE inhibitors and ARBs, blood pressure medications. Lisinopril, enalapril, losartan, valsartan. These are cornerstones of treatment for high blood pressure, heart failure, and kidney protection in diabetes. They are excellent medications, but they work in part by relaxing certain blood vessels inside the kidneys. Normally this is beneficial, but when you're dehydrated, your kidneys rely on those same blood vessels tightening up to maintain blood flow and protect themselves. These medications block that protective response, so a patient who is dehydrated from diarrhea and is on one of these blood pressure medications loses a kidney's built-in safety mechanism. This significantly increases the risk of sudden kidney damage, sometimes severe enough to require emergency treatment. This combination deserves urgent medical attention, not watchful waiting. Interaction number four, and this one I want you to pay very close attention to: warfarin and Bactrim. Many older adults are on warfarin, a blood thinner for conditions like atrial fibrillation, blood clots, or mechanical heart valves. If you or a loved one is on warfarin and gets diagnosed with Cyclospora, the treatment, Bactrim, blocks a specific liver enzyme that your body uses to break down warfarin. When that enzyme is blocked, warfarin builds up in the blood to higher than expected levels, significantly increasing the risk of serious or even life-threatening bleeding. This is one of the most well-known and dangerous drug interactions in medicine. If Bactrim is prescribed to someone on warfarin, a blood test called an INR, which measures how thin the blood is, must be checked within 3 to 5 days of starting Bactrim, and possibly more often. Please make sure your physician and pharmacist are aware of this combination. So if you or someone you love is an older adult, or you're a caregiver for one, here are 5 things to do right now. Number 1, know the symptoms and the timeline. Watery diarrhea, sometimes explosive, fatigue, loss of appetite, stomach cramping, bloating, nausea, low-grade fever, and weight loss, particularly if they began about 1 to 2 weeks after eating fresh produce. Symptoms can last from a few days to a month or longer without treatment, and can come and go, with relapses even after you start feeling better. Number 2, ask for the right tests specifically. This is critical. Standard stool cultures do not detect Cyclospora. Routine stool tests for parasites typically do not include Cyclospora testing unless it is specifically requested. When you go to your doctor, the words you need to say are, Please specifically order a stool test for Cyclospora. There are several ways to test for it. A special stain called a modified acid-fast stain, a UV light test, or a DNA-based test called a PCR. Not all stool PCR panels include Cyclospora. For example, the BioFire panel does include it, but other panels may not. You must ask specifically. You may also need to provide more than one stool sample, collected 2 to 3 days apart, because the parasite doesn't always show up in every sample. Number 3, stay aggressively hydrated with electrolytes. Plain water is not enough when you have significant diarrhea. You are losing sodium and potassium along with fluids. Use an oral rehydration solution. Products containing the right balance of salt and sugar to help your intestines absorb water more effectively. In older adults, if you can't keep fluids down or if you have confusion or dizziness develops, this warrants a trip to urgent care or the emergency room for IV fluids. Number 4, conduct an immediate medication review. Make a list of every medication you or your loved one takes. If any of them include a water pill, metformin, a blood pressure medication like lisinopril or losartan, or warfarin, contact your physician or pharmacist the same day. Do not wait. The infection itself may require temporary medication adjustments that only a qualified clinician can safely guide. Number 5, be cautious with fresh produce right now. Until the infection is contained, consider reducing your consumption of raw, fresh produce that cannot be cooked, particularly fresh herbs, bagged salads, and berries. Heat kills Cyclospora. Cooking your produce thoroughly eliminates the risk. Cooked vegetables and heat-processed foods carry no risk from this parasite. For younger, healthy adults, it typically causes a miserable but manageable diarrheal illness. For older adults, the stakes are higher because of age-related immune decline, reduced fluid reserves, and the very real danger of interactions with common medications for blood pressure, diabetes, heart failure, and blood thinning. If you found this video helpful, please share it with someone over 60 who needs to hear it, a parent, a patient, a neighbor. That share could matter more than you know. And if you want to stay ahead of health information that is specifically relevant to older adults, evidence-based, clinically grounded, and free of the noise, subscribe to this channel. New videos every week. I'm Dr. Kobi Nathan. Take care of yourselves and the people you love.